Hey y'all, if you're in endocrine med surg, I want to go through these. This is the only reason I know anything about endocrine. Okay, this is go-getter Gertrude. Look at her. She says, everything's running except my periods. And she's got a short sleeve shirt on and shorts and eye condition. So let's read the story. Go-getter Gertrude will help you remember the major symptoms of hyperthyroidism. Her last name, of course, is Graves. Graves' disease is the result of the hypothyroidism. One look at this visually stunning creature, and you can see how thin she is and how her eyes bug out. That's called exophthalmos. Y'all be looking at folks in Walmart now. Everything is running except her menstrual periods. Her heart rate's running fast. She has increased pulse. Her blood pressure's running up. Her basal metabolic rate, BMR, is running. Therefore, she's going to metabolize drugs faster. And she can eat a whole chocolate cake without ever gaining an ounce. Yeah. She is running so fast that she is cleaning out closets that don't even need to be cleaned at 3 in the morning. Notice she's wearing short sleeves and pants because it takes a lot of energy to run, and she is hot all the time. While planning her nursing care, lower her room temperature and get rid of all them blankets. This is important next. A quiet room for people with hyperthyroidism will be great because they're nervous as a dad-playing cat. And nurses are loud. So don't put it by the nurse's station. Well-balanced meals, high in calories and vitamins, are a must due to the eye changes protect the corneas from drying. Go-getter Gertrude's diagnostic test would reveal an increase in the following reports. Her T3 and T4 are going to be up. Her BMR is going to be up. And the uptake of 123 iodine is going to be up. But her serum thyroid stimulating hormone will be decreased in hyperthyroidism, because usually the thyroid can't fart unless the TSH from the pituitary tells it to. And so hyperthyroidism is because the thyroid's just putting out T3 and T4 because it wants to. That's not how it's supposed to be. If the problem was because of the TSH, it would be called something else. Okay? So remember that the TSH, the thing that's supposed to make it do what it does, is low because the thyroid just, out spreading their T3 and T4. Anyway, okay. So a thyroidectomy. You see the post-op thyroidectomy, the little acronym is bleeding and beware a thyroid storm, open the airway, whisper, trach at the trach set, incision, and emergency. So listen, the stuff in this thing's important. So it says the bow tie around his neck because of the hyperactive thyroid gland has been removed. Post-op can be a crucial period for these folks because they may bleed. Often the blood collects behind the neck, being pulled by gravity if he is lying on his back. So look, what are we going to do for thyroidectomies? We're placing them in the semi-Fowler's position to avoid tension on the suture line. Observe the airway, my word. Due to the potential swelling from being traumatized during surgery, the vocal cords may be swollen. So you as the nurse have to know to assess frequently for noisy breathing and increased restlessness. You see that word right there? Every time you see it, I want your butt puckering, thinking low O2. Restlessness, low O2. Okay? Evaluate vocal changes. Increased hoarseness may be indicative of laryngeal edema, which is going to close his throat. If these people get into trouble, they can lose their airway fast. It's advisable to have a tracheostomy set. You got to know that. At thyroidectomy. That'd be on your NCLEX. You ought to write that down every time I say it. Available to open a emergency airway. The incision needs to be observed for swelling, which can occlude the airway. Watch for normal wound healing. We don't want an infection in his throat. Evaluate the calcium levels. Parathyroid glands may have been damaged or accidentally removed. And since calcium potentiates the movement of electrolytes across the cell membrane, and electrolyte balance is imperative for the heart cells to work, Father God, low levels could create an emergency. Low levels of what? Low levels of calcium. Parathyroid hormone. If parathyroid is up in the blood, calcium in the blood is going to be up, which ain't always a good thing. Because where's that calcium coming from? Your bones. So if parathyroid in the blood is up, like in hyperparathyroidism, then your main concern is their calcium level. Okay? If parathyroid hormone's down, calcium in the blood's down. Where's it going? Back in the bone. There's other hormones that control that, but I'm just trying to make a memory in your head. Okay. I don't even know where I was. Trach set. Wound. Yeah, emergency. Look, so have what you said, calcium gluconate available on a thyroidectomy. You have to have a calcium gluconate and a trach set. And NCLEX wants to know that you know that. Available. So then we got one more. Now look, this is morbid Matilda. She has hypothyroidism. And look at her. Everything is running slow, including my periods. So if you got a jacked up thyroid, you're not having a period. Either way, you know. Somebody be happy with that, somebody not. But look at her. She got pants on, her hands in her pockets. So let's read her story. This vision of loveliness is morbid Matilda. Her last name, as you probably guessed, is myxedema. That's with hypothyroidism. She has a slow deterioration of the thyroid function. It occurs mostly in older adults and 5 times more frequently in women than in men, of course. As you can see, Matilda got the family bug eyes, and she has no periods like her sister Gertrude, but that is where the resemblances end. Matilda's not thin. In fact, she can look at a piece of chocolate cake and gain weight. And she'd rather be sleeping at 3 a.m. in the morning than cleaning closets. And she might be sleeping at 3 in the afternoon because of her lack of energy. And her long pants and putting her hands in her pockets will keep her warm. So increase her room temperature may be necessary. Give her Gertie's blankets, Matilda, this woman, is going to be on lifelong thyroid replacement. Your thyroid controls a lot of stuff. Your metabolism, all kinds of stuff. But she's going to have to take it for the rest of her life. So be prepared for a patient teaching question where you got to tell her you have to take this for the rest of your days. And she'll be on a low-calorie, low-cholesterol diet to help with weight loss, and she don't like these changes. She's not a happy camper. I don't think that I would be either. Got Gertie running around cleaning everything, and I can't even get up off the couch. Okay, there's thyroid. Have a good day.